Hello, welcome to NU 621 Advanced Pathophysiology Week 3. This video will bring you information concerning measles. Measles has been in the forefront recently. It was thought to be eradicated and now has come back into the national health scene. So these are the references that were used to compile this video, and feel free to access them. Of course, the CDC has all kinds of wonderful information on that site. You can spend a long time there looking for all kinds of things. But they do have specific information about measles. Again, I think it's a very timely topic. In fact, it was declared eliminated in the United States in 2000. And up until 2011, there were minimal cases. And then in 2011, there was a spike in the number of measles cases that were being reported. And then in 2014, there were more cases that year than in any other year since 2000. There were 288 total cases of measles. 69%, or 200 of those cases, were in unvaccinated individuals. 20% of the cases of measles were in individuals in whom the vaccination status was unknown. And 97% of all the reported cases in 2015 were documented to have originated in 18 other countries. So it is a traveler's disease transmission route, and in fact on the CDC you will find travel advisories specifically concerning measles. Its transmission is important to note because it is easily transmitted and it is highly infectious. It lives in the nose and throat of an infected person. It's spread through the air through droplets from coughing and sneezing, and it can live up to 2 hours in an airspace where an infected person has coughed or sneezed. So this is particularly concerning in an airplane. If that person sneezes while you're in the plane, that could be an issue, but also if they sneezed or coughed just before they got off the plane and then you get on. So these are some of the reasons why it is a traveler's advisory disease. In 2014, the American Academy of Pediatrics updated their guidelines in light of all the number of cases of measles. And I've included some of the highlights here in the changes that they have suggested. That there be evidence required for measles immunity. There's guidelines for the use of immune globulin, vaccination for healthcare personnel, and the management of patients with HIV infections and other susceptibilities. It's now part of our fabric that healthcare workers are thought about when they're on the front lines. How do we protect our healthcare personnel? How do we protect ourselves from being exposed and or coming down with the disease that we have come in contact with? How do you provide evidence of immunity? Well, there's several ways. There could be documentation of age-appropriate vaccination with a live measles virus-containing vaccine. And the current recommendation is 1 dose for preschool-age children, and then 2 doses for children in kindergarten through 12th grade. And the 2 doses are separated by at least 28 days. You can do laboratory tests to show evidence of immunity. You can confirm that a person has the disease through a blood test. And if the person was born before 1957, it used to be a blanket thought that they were immune from the disease. They're finding that that's not quite the case anymore, and so that they still need to provide documentation. It is thought that once you've had the vaccine for the measles or you have had the measles, you have lifelong immunity. The use of immune globulin is recommended either IM or IV to be given within 6 days of exposure. This will help prevent or modify the measles response in people without evidence of measles immunity. So if you are wondering what the immune status is of an individual, you have time to get a blood test, have the results come back, and administer the immune globulin if they do not show evidence of immunity. It's also recommended in everyone older than 12 months, anyone infected by HIV, except those who are severely immunosuppressed. It has been shown to be fatal in patients with HIV. If you think about it, they have severely compromised immune systems, and then we're going to introduce a live vaccine. So we don't want to give that to someone who has no way to defend themselves against the virus. And it's recommended not to immunize for at least a month if they've recently had high-dose course of steroids, as this will affect their immune system response to the virus. For healthcare personnel, it's recommended that there be evidence of immunity. If there isn't, then everyone, including students, should be immunized if they've been in contact with patients with measles, confirmed cases of measles. To diagnose it, you do serologic testing. There are specific IgM and IgG titers that are used. That information is well beyond the scope of this video. But if you are involved in drawing lab tests to confirm the diagnosis of measles, you will be very familiar with these. You can isolate the virus in blood tests. You can do throat or nasopharyngeal swabs, and you can also diagnose using urine specimens. And the sources that have been cited give you all the specific information about which test you use for the urine specimen, which you use with the throat swabs, etc. It is a highly infectious disease and a highly contagious disease, and it needs to be reported either to the local or the state health department. The CDC has issued guidelines for reporting measles cases or suspected measles cases, and you'll note that it's pretty general. And so you catch a wide number of people in your net. The CDC recommends a general rash lasting 3 days or longer should have reported for possible measles exposure. Running a temperature of greater than or equal to 101 degrees Fahrenheit. If they have a cough, if they have conjunctivitis or coryza, which is an acute inflammatory contagious disease involving the upper respiratory tract. So as you can see, it's very general information. But if a person has these three symptoms, it should be reported. And then you should go into testing and evaluation. The treatment is supportive. Keep them comfortable. Maintain hydration, especially if they're feverish. They're not going to want to stay hydrated or drink anything. So, with children, you sometimes can use popsicles, but maintain hydration. The World Health Organization recommends that all children with measles, regardless of what country they are in at the time of diagnosis and how old they are, should receive vitamin A supplementation. Treating with vitamin A has been associated with a 50% improvement and reduction in morbidity and mortality from the measles, and it does appear to help prevent eye damage and blindness. So the WHO, the organization, not the rock group, recommends that all children get this. Have any questions? Please call me and let me know what's going on. Thank you for your time.